I feel desperate.
Many of us are hanging on by a thread.
Couldn't even survive if they make any cuts.
It devastated our savings.
It's hard for me to breathe without my medication.
He had a traumatic brain injury.
She's on oxygen 24 hours a day.
Paralyzed from the neck down.
And then she had a second stroke.
We depend on medications.
Seniors really need help.
I don't know how we would manage.
I don't know how to make it.
I never thought anything like this could happen to me.
The 24-hour care.
We're worrying about, what if she gets sick?
We need our care.
I don't know what we'd do.
Please don't make these cuts.
My name is Catalina LaCruz. I am a mother and special education teacher working in Pomona, California. Today, I joined forces with Californians for Patient Care, which is a patient care advocacy organization, in saying no to the proposed budget cuts in healthcare.
Californians for Patient Care knows that state leaders are in the process of making tough decisions to balance next year's state budget. However, if the proposed cuts to Medi-Cal and Health and Human Services are made, millions of Californians will be impacted. Kevin and Christine Curran live in Northern California. In 2005, Kevin suffered a severe brain injury after being involved in a car accident. As a result, Kevin lost his ability to take care of himself and currently resides in a long-term care facility.
He needs 24/7 supervision because of a brain injury. He doesn't sleep normal sleep patterns, and sometimes he forgets because of the short-term memory. If the budget cuts would happen, then I think that neither one of us would have any life at all. It would just be existing day to day, trying to maintain our health. And to do that on my own, it would be impossible. It makes me feel like he won't have a quality of life. And if he doesn't have one, then I don't either. But it's not just us.
Well, after I had my daughter, I had to go on Medi-Cal for a year because I couldn't get a teaching contract. Even though I had all of my certification, there just weren't any jobs. And I was only offered substitute positions or long-term subbing assignments, which they don't provide benefits. And all that time you're worrying about, what if she gets sick? Staying awake late at night thinking, what am I going to do? I need to take care of her. I need to do whatever I have to do to make sure she's okay. And having Medi-Cal made me more safe and comfortable in knowing that she was safe, because everything is about her. It's all about her. Everything that I do is for her.
If these budget cuts are made, it would cause a real hardship for the quality of her life. Getting these medications, it means a lot, because all of, like the blood pressure medicines and all the different antibiotics and things that she has to be on for various things, and the other medicines that just help her with her daily living is very important.
I had an ocean diving accident, and I became a quadriplegic, paralyzed from the neck down. Since that time, my wife and I have found our medical expenses to be astronomical. While we appreciate any assistance we get, people that are in the state and the condition that I'm in would find it very difficult to maintain their medical care, their therapies, and their medications if the state health budget becomes reduced.
If the budget cuts happen and we end up having to close, they're all going to have to move. There's nothing, families, they're here for a reason. They're here because they need to be taken care of, and families can't do that. They'll have to move.
In January, I had my leg amputated because I had poor circulation, and I do need to stay here because I need 24-hour care. This facility was not here. I can't imagine where I would be or what my family would do, because it would be a hardship on my family, and this is what I don't want to happen.
You don't realize how devastating it is until it actually happens. You see it on TV, but you don't know what it is until you live it. And that's where we are. And I really hate to think of them cutting a budget that has to do with supporting this, especially after you figure these people are what made California. It's their tax money, and they're working, that built this state and put in 50 and 60 years of their life. And to have this cut take place, the devastating effect it'll have on not just my parents and their livelihood, but what about all the rest of them?
Please try to let us be able to get our medication. Right now, this is basically what's keeping us alive. Without it, it's hard for us to make it.
These patients represent only a small fraction of the millions of Californians that will be devastated by the proposed $3.4 billion decrease to both Medi-Cal and Health and Human Services. Make no mistake, reductions of this size will cut lives short. Governor Schwarzenegger and legislative leaders, it is time to put patients first. Listen to the Californians that have taken the time to tell you their stories and the millions of others that will suffer. Californians for Patient Care believes that you, like us, want to protect the health and well-being of the most vulnerable in our population, the millions of children, families, seniors, the disabled, and those that are chronically ill and in the greatest need.